For those of you who are not familiar with me, my name is Joanne Pong. I'm the owner and founder of Manual Physical Therapy. We specialize in chronic pain. So those people who have tried everything and found nothing that worked, those are typically the patients who end up seeing us. Of course, it doesn't mean that you're going to wait until you get to the point. We would also welcome those who just want to get to the root cause and fix it right away. Today's topic is about TMJ, and I wanted to discuss that because most people, when they have a TMJ problem, they think that they just need to fix this part. But it is a lot, it's way more than that. TMJ problem, usually there is a coexisting neck problem, shoulder problem, or even headaches. So I want to explain the relationship of all four. If you happen to just be looking at or having a problem with a TMJ, to some degree you're lucky, but I just want you to understand that in order to fix a problem, typically it involves the neighboring joints. The other thing that I want you to think about is, if your TMJ is on the right side, for example, one of the things that you should be thinking of is, why is it the right side that is having problems? Why is it not the left? There is usually a reason behind it, and we'll take a deeper dive into why that is the case. What are the underlying causes of TMJ? So as far as we're concerned, one of the biggest reasons why people end up with TMJ is not just the grinding, which, most people, that's what they think of, is they grind at night. But if you look at yourself in the mirror, I want you to look at your shoulder. Does it look like one shoulder is ever so slightly higher than the other? That means that your rib cage is actually tilted. If you feel like there's no difference between the right and the left, one of the ways that can help you is if you put a pen, let's say you put a pen and rest it right on top of your shoulder like that, okay? And then you put the pen on the other side. Do they look do they look the same, or is it that one pen is slightly more slanted and the other one is kind of more horizontal? So that will tell you that your rib cage is kind of tilted. So what does it mean when the rib cage is tilted, or what does it mean when one shoulder is lower than the other? Essentially, that means that the entire rib cage is actually tilted. So it has nothing to do with the shoulder itself. It's a fact that your rib cage is tilted. Now, for example, the way I am, positioned right now, so you can just imagine that the muscles on this side that goes to your neck, because there's going to be muscles that start from around this area and they extend all the way to your jaw. And of course, there's a couple or three muscles that actually attach to your head. So you can just imagine that one is going to be overstretched. So the lower part is going to be overstretched. But for example, right now, my right shoulder is lower and my left shoulder is higher. So you can just imagine that on this side, okay, these muscles are tight. But on the other side, these muscles are actually overstretched. So you got to understand, when you say something is tight, is it tight because it is truly tight like this one? Or is it tight like this one, which is, in this case, the muscles are actually overstretched? Now, another way of looking at why you end up with TMJ is if you look at yourself on the side, okay? A lot of people will end up with what we call a forward head, where their head is actually slightly forward. And when that is the case, people try to push it back or do all kinds of exercise to straighten it out, to improve the posture on this area. But really and truly, when you have a forward head posture, that posturing can also be, or more likely is coming from, or is caused by, your feet position. So I'm going to briefly explain that because that seems so far-fetched, right? So here's what happens. So when you're standing on both feet, okay, and if you find, I want you to observe how or where the pressure or the body weight lands on your feet. Now imagine if the body weight is actually more on the heels. So imagine if the weight is more on the heels. So if it is more on the heels, that actually means that I have a slight tilt backwards of my body. So my body is kind of tilting back a little bit. And so there's more weight on the heels rather than the weight being distributed evenly. And so what happens when that is your posture is your body is going to say, wait a minute, I'm falling backwards. And so automatically, without you realizing it, the head will actually go forward to counterbalance it. So you will have a forward head to counter the bad posture down below. Consider that, because if you have a neck issue or if you're trying to fix a TMJ, I want you to look at the body as a whole, because there's usually a connection there. Now, the question of why is it that when you have a TMJ problem, you sometimes get a headache, you have a neck problem, you have a shoulder problem. So specific muscles overlap. They're called myofascial lines, and they don't all overlap. There's only certain ones that overlap. Sometimes there's muscles here that go all the way to the top, and it creates a dysfunction on one side but not the other. A good example is if you are tilted like this, so you can see how that is tighter compared to the other side. Sometimes not only will you have a tilted rib cage, but you will notice that you have a slight tilt in your head, and sometimes you actually have a slight turn. Okay, so I want you to even look at your pictures and see if you have a tendency to tilt your head or to even turn a certain way, and that is not a habit. That's actually muscles that are tight. In other words, a headache and a TMJ problem, a neck problem, and a shoulder problem, they tend to be connected. So it's not just one problem and then you have another problem. One of the most common exercises that is recommended for TMJ is actually to bite on a pencil. And then you kind of bite it tight and you hold it and you do a lot of repetitions. I do not recommend that at all. Okay. So the reason for that is when you have TMJ problem, which is like right here, that means that there's a muscle that's literally like a rectangular muscle that starts right about here and ends right here. So it's kind of like a rectangular muscle like that. And that is one of our chewing muscles. Okay. So when you bite down, then that muscle contracts. Now, interestingly enough, there's another muscle that is also responsible for chewing. So in addition to this masseter, right above the cheekbone, right here, there's a muscle that literally goes like this and it kind of wraps around here. And it is called a temporalis muscle. You know, when we say temple, so that muscle is called a temporalis muscle, and those are chewing muscles. So when you have a TMJ problem, that actually means that those muscles are tight. So what happens if they're tight and you try to strengthen them by biting on a pencil? You are just tightening a tight muscle. So to me, what needs to happen is you have to stretch these muscles that chew, okay? So you need to stretch that, and that will allow your mandible to have a better relationship with your maxilla. Okay, so these are the two bones, and when they connect here, they can have a dysfunction. So to me, stretching is the key. Now, what I found very interesting is that when I Google, what things you should do and what you should not do, one of the things is do not yawn or avoid yawning and avoid singing. And here I am saying, Those are good things because when you sing and when you yawn, guess what happens? You are actually stretching your masseter, okay? And so I'm going to show you briefly what they look like. Okay, I'm going to raise it up like that, okay? So this is right here down below. That's the masseter right here, this one, okay? And this is the temporalis right here, the orange part, okay? Like that. So when they are weak, it doesn't mean they are just weak. It usually means that they are tight and therefore they are weak. So I'm going to explain what that is. So when you're talking about muscles, okay, muscles, and you know how you talk about contraction, okay? So what does contraction really mean? So if you have a bicep, that is contracting, right? It is shortening. So when you really look at what is happening there, in a layman's term, imagine that you have two forks that are facing each other, okay? And when they contract, these muscle fibers will slide in. That's what a contraction is. So in this case, it's like two forks are sliding together. And then in order for that to relax, that means these muscles here have to contract to pull it apart. In other words, in our body, there are a lot of teams of muscles. One will go one way and then the other one will go another. So in the case of a tight masseter, that means that instead of once it contracts and you relax, instead of it going back to the starting point or what we call a baseline, when it's tight, it actually stops right here. In other words, it cannot go back. It will stop here. Now remember what contraction is. It needs to slide forward, okay? So if it is tight, when it tries to slide forward, that means it's weak because it does not have the leverage to slide forward that much. So a tight muscle is usually weak. So I want you to understand that because instead of trying to strengthen a tight muscle, as in, what you find on Google, which is to bite and strengthen it, you should consider stretching it. I want you to consider what are you doing that you don't realize is actually aggravating your headaches, your TMJ, your neck problem, your shoulder problem. One is, how do you use your pillow? So a lot of times we just mindlessly use like a pillow that's too thick, too small, or too thin, or maybe even use two pillows. What is the purpose of the pillow? The purpose of the pillow is literally just to maintain the head position in relationship to the rib cage in neutral position. So for example, imagine that I'm sleeping, okay? If I use too thick a pillow, my head is going to go this way, right? And if I'm sleeping or lying down and my pillow is too thin, then I'm gonna go back. Okay. So in the process, if you have a thin pillow, you are going to tighten these muscles. Okay. Now, if you use a pillow that's too thick and your head goes this way, you would think that you'd become flexible. But what is really happening there is when you sleep with a thick pillow, you are overstretching your neck muscles and the body responds by protecting it. So when the body thinks, wait a minute, you are overstretching me all night long, so I am going to tighten you up. And so either way, whether you use a thin pillow or a thick pillow, it will do the same thing. It will tighten up your neck muscles, which of course leads to headache and leads to a TMJ issue or a shoulder problem. So what I encourage you to do is I want you to lie down and have your spouse If you have someone there with you at home and you don't live alone, have your spouse take a picture of your position when you're sleeping and find out if it's neutral or not. Now, what's interesting about that is if your muscles are tight, if you try to bring it to neutral, you won't be comfortable. So if that is the case, then you need to stretch your muscles. And I would highly encourage you to call us to find out what you can do to help, eventually return it to neutral. The other one that you might be doing that you don't realize is actually creating your headache, your TMJ, your shoulder, your neck problem is, believe it or not, watching TV and falling asleep sitting. So the question is why? Because if you're watching TV and you fall asleep, guess what happens to your neck? It's going to fall in a very awkward position. Again, that means in this case, this will tighten up and this one will be overstretched. And because this is overstretched, the muscle is going to say, wait a minute, you're overstretched. I'm going to tighten you up to protect myself. And then both are going to be tight. Okay, so something that I'm sure has happened to you, but I want you to be mindful. That is one of the reasons that you end up with these types of problems. The other one is sleeping on your stomach. There is nothing good about sleeping on your stomach. I joke about if you can figure out that you can sleep on your stomach without turning your head, right? So in other words, if you have a bed with a big hole and you can breathe down and sleep that way, it's okay. But what happens when we sleep on our stomach is, let's say this is the bed and I'm going to sleep on my stomach. In order for me to breathe, I have to turn my head, right? And so in the process, there goes the misalignment. One muscle gets tighter, the other one gets overstretched, and then the overstretched muscle will protect itself by triggering the protective response, and then there goes your problem. So remember how the masseter and the temporalis, their job is to chew. So if you're going to chew gum, guess what? You are constantly contracting these muscles. And so in the process, when you overuse it, you end up with an overuse shortened muscle. So that's why I don't encourage chewing gum. I've already mentioned the fact that you should not be biting on a pencil. Honestly, if people disagree with me, I look at it from the point of view of, are you trying to strengthen it or are you weak because it's tight? And I cannot imagine strengthening a tight muscle to be an effective way of treating TMJ. So I would say stretch first, and then you're going to feel better. And then if you want to, you can strengthen it. But really and truly, we eat every day. In other words, we strengthen our muscles every day. So really, I don't encourage that type of strengthening. Okay. Now, you're probably familiar with a mouth guard, okay, or a night splint. For people who are anxious and stressed out, when they fall asleep, they tend to clench. Okay. So when you're clenching, that means these are overworking all night long, and the temporalis are going to be working all night long. So what can you do to help? I recommend meditation. Now, most people will meditate first thing in the morning, and I myself do it, and I feel that it really helps me face the rest of the day. But for people who have TMJ or they tend to grind their teeth, I would say work on meditation. Do that at night to help relax your whole body, and hopefully it will minimize the clenching. Usually, I encourage that people do stretches first thing in the morning. Okay. So why do I encourage people to stretch first thing in the morning? Because that allows you to function better for the rest of the day. But in the case of TMJ, it's a little bit different because the problem usually occurs at night when you're clenching. So I would say at that point, if you have this issue, do stretches before going to bed. I am going to show you a few things and hopefully it will help you. So, because that's one of the things that I really want to do is for you to take away something that you can find helpful. Now, I'm going to warn you, this will seem counterintuitive, but if you give it a shot and give it a try, I promise you it's going to help. Okay. So remember that these muscles are one of the biggest culprits of TMJ, the chewing muscle, right? So they are tight and we want to relax them. Now, when you're talking about muscles, there is another component to a muscle, and that is the fascia. I don't know if you are familiar with fascia. So again, I'm going to show you that that's the muscle I'm referring to. That's called the masseter, the chewing muscle. There's actually another muscle which is way deep, and that's another masseter, but they all do the same. One is a superficial and one is a deep. The fascia is like the covering of the muscle, but it doesn't just cover the muscle, it covers all of us. The medical term for it is connective tissue because it essentially does that. It connects us from head to toe. Okay. So it's essentially like our skin, you know, how the skin connects us from head to toe, but this time is what's under it, the connective tissue. So in this particular case, very likely the fascia is affected here. So here's the exercise. You are going to slightly open your mouth. So you're not going to open it wide, okay? You're going to just do this. You see how I'm just slightly opening it? And then you are going to shift the bottom jaw, okay? And I want you to shift it to the right and to the left. And I want you to determine which direction is more painful. If there is no direction that is painful, which direction feels tighter? Okay, so I'm going to do it myself first. So I'm going to slightly open my mouth and I'm going to shift. So in my case, going to the right felt somewhat tighter. And it doesn't have to be a dramatic difference. It can be just slightly tighter. So because shifting my jaw to the right was tighter, I'm actually going to exercise to the easy side. To the easy side. You did not hear that wrong. And I will explain it in a bit why you have to do it in the easy side. So in my case, that is tight. So I'm going to go this way and I'm going to hold it for 20 seconds and do it gently. Don't exaggerate it. Don't push it too much. So you hold it for 20 seconds in this direction, which is going to the left. You hold it for 20 seconds. And then after the 20 seconds, you go back to midline, to go back to neutral. And then you repeat it to the easy side for a second set of 20 seconds. And then after you do 2 sets of 20 seconds, I want you to try going to the other side just briefly, just to retest, and very likely you will notice a slight improvement. Okay? So that is the simple exercise, is to just shift it. And what you're doing there is essentially bringing the fascia into a more neutral position. Okay. The other exercise, because remember how I said that a TMJ can cause headaches, can cause shoulder problems. I'm going to give you 2 more exercises. And if you want a copy of this, I can email it to you. Okay. So there is this muscle called the scalene. And I'm not going to go into detail, but it literally starts from the first rib. Believe it or not, our first rib is up here. People are always surprised that the first rib is right here. So from there, it connects to the ear. And so when that is tight, it gives you a little tilt, right? Because if it's tight, it's going to pull. And so The key is to bring the body into neutral. Why is it that we need to keep our body into neutral? Because that is a normal function. And so what happens when it is tilted? The body will try to communicate with you that something's wrong with it. How does the body communicate with you that something's wrong with it? By hurting you. Okay? Because pain is just our alarm system. And so when you are in pain and you find yourself somewhat tilted, if you actually work on trying to be neutral, then that means you get to shut off your alarm system, which is your pain. Now, that's essentially how we do things here. We just identify what's lopsided and we bring it to neutral and we shut off the alarm system. That is what we call getting to the root cause of the problem. Okay, so here is the other exercise. So you're going to tilt your head to one direction and then the other direction and determine which one is less painful. Remember, you are going to exercise going to the easier direction to the less painful direction. Okay, so in my case, this feels easier, that one is tighter. So if this feels easier, this is what I'm going to do first, right? And I'm going to back up a little bit so you can see what I'm doing. In order to stretch it, you're going to sit on your hand like this, not this way, but this way, okay? And then remember how this was easy for me? So you are going to give it a gentle stretch, okay? And you're going to hold it for 20 seconds. Anyone who's familiar with me will recognize that I always talk about 20 seconds. So you're going to hold it for 20 seconds, and then you're going to relax, and then you're going to repeat in the same direction for 20 seconds, okay? And then, so you do it twice on the easy side. And then once you flip over to the other side, you are going to notice that it will be 5%, if not better. But it will change most of the time. If it doesn't change, that means the actual muscle is tight. It has nothing to do, or it's less likely that the fascia is involved. It's more of the muscle. The third exercise I'm going to give you is I want you to turn your head and don't overturn it. Just go to 45 degrees and then you're going to look down. I call it, it's like saying you're looking down at your breast or you're looking down at your armpit, but don't overturn it. So you're going to turn your head this way and you're going to turn your head this way. Whichever is the easy one is what you're going to do. Okay. So in my case, this is easier. So this is where I'm going to go. So then I'm going to put my hand here again, and then I'm going to stretch it this way. You notice I'm no longer stretching this way. I am stretching in this direction. Okay. So again, hold it for 20 seconds, come back to neutral, hold it for another 20 seconds. And once you're done with the easy side, 20 seconds times 2, you switch over, you only do it once. So I'm going to explain to you why this almost does not make sense, okay? I am not stretching your muscle. I am untwisting your fascia. That's the difference. So, for example, I'm going to explain to you what that means. Why is it that you have to stretch the easy side and not the tight side? Because that surely seems counterintuitive, right? So, for example, remember what I said, fascia is like the clothing, the covering of the muscle, right? So I'm going to demonstrate it with my arms just for ease of demonstration. So if my fascia, for example, is twisted to the right, you notice that I can't go very far here, but I can go higher here, right? So typically, the direction of twist of the fascia is the one that is more painful or tighter, just like I've demonstrated it to you, right? That's tighter, that one goes higher, right? So imagine if my fascia is twisted, you notice how hard it would be to move myself, right? To function with a twisted shirt, that would be very uncomfortable. And so what I really want you to do is untwist your fascia. So if my fascia is actually going to the right, That is the reason why I want you to do the easy side, because when I make you do this, you notice that I'm actually untwisting your fascia, right? You see that? Okay. And then you go back down, and it's almost like just resetting it. And then you do it again. And you can see that I'm untwisting your fascia. And that is the reason why when you do a retest, now the fascia is more neutral. It feels better. The tendency of people is, if I'm tight here, that means I need to stretch this, right? That's what most people do. But I'm telling you that if you do this, knowing that we are wanting to untwist the fascia, you will get more results.